Hello, my name is Angela Prescott from the University of Pittsburgh Department of Plastic Surgery, and today I'll be discussing the use of epinephrine and the acute traumatic hand in the emergency room. Forbidding the use of lidocaine with epinephrine in the hand is a myth that has been debunked. Prior studies have demonstrated that it is safe to use local anesthetic with epinephrine in digital blocks, carpal tunnel surgery, and elective hand procedures under Wallent methodology. We continue to challenge the dogma in acute hand trauma in the ER. Our goal was to investigate our institutional use of local anesthetic with and without epinephrine in our ER patients with acute hand trauma. We hypothesized there is no difference in complication rates when comparing acute hand trauma patients treated with lidocaine plain versus those treated with lidocaine with epinephrine. Under IRB approval, we performed a retrospective chart review of patients presenting to 2 of our level 1 trauma centers with a diagnosis of acute hand trauma who met these inclusion criteria. Patients under age 18 and those with inadequate follow-up were excluded. Patients are treated with either lidocaine plain or lidocaine with epinephrine in the concentration of 1 to 100,000. The patients in our study were stratified into 2 groups based on what type of anesthetic they received. Type of local anesthetic used was based on resident preference who is rendering care. Listed here are the parameters we evaluated. Primary endpoints included post-injury rates of infection, need for antibiotics, rates of necrosis, stiffness, and need for reoperation. Secondary endpoints included the need for OT, length of OT, and time to resolution of injury. Fisher's exact test was used to analyze categorical variables. ANOVA one-way was used to analyze time variables. Multiple fit models were used to analyze which variable was most strongly correlated with having a post-injury complication. 150 charts were reviewed, 38 patients with 58 injuries met inclusion criteria. Patient age ranged from 19 to 84 with an average age of 51. The majority of patients were right-handed males with equal rates of injury to dominant versus non-dominant hands. Patient demographics such as age, sex, comorbidities, smoking status, handedness, and occupation were evenly matched regardless of what type of local anesthetic was used. There was no statistical difference between the 2 treatment groups with regards to level of injury, mechanism of injury, or structures injured. There was no difference in wound management, use of IV or oral antibiotics, or time to first clinic visit. Patients in the epinephrine group did experience statistically shorter time from ER to OR intervention. Local anesthetic with epinephrine had no statistical correlation with poorer outcomes. There was no difference in rates of stiffness, infection, need for repeat antibiotics, presence of necrosis, rates of reoperation, need for OT, length of OT, or time to final clinic visit. Rates of post-traumatic infection were significantly related to presence of multiple patient comorbidities and the mechanism of injury. Need for repeat antibiotic treatment was significantly correlated with multiple patient comorbidities and smoking status. Stiffness and reoperation rates were statistically related to patient comorbidities with a p-value of 0.002. None of these post-traumatic complications were correlated with the use of lidocaine with epinephrine. Limitations exist as this was a retrospective chart review. The study is underpowered with an N of 38. Bias exists in this study as the decision to use lidocaine with epinephrine versus lidocaine plain was not randomized and was based on the preference of the resident administering care. Phentolamine was used in 1 patient in the epi group due to blanching of the subcutaneous tissues. Our early data demonstrates that plastic surgery residents treating acute hand trauma in the ER may continue to use lidocaine with epinephrine without posing further increased risk of complications. Factors associated with complications after acute hand trauma are multiple patient comorbidities, smoking status, and mechanism of injury, not the presence of epinephrine in the local anesthetic. Thank you, and I look forward to continuing analysis in this very important topic.